I'm Gopalan Shivakumar and known to patients and people as Dr.Goshi. I'm specialized in neuro rehabilitation and my main field of work is in acquired brain injury and genetic disorders for children and adults. My concept of treatment is called cortical retraining and repeated intensive rehabilitation to brain. It is called RIP, R-I-P-B, RIP. One, come on, two. If I touch a patient like that, immediately this tactile sensation is sent to the second just part of the body in the spinal cord. The spinal cord then takes back to the brain and the brain responds back. So if instead of doing only once, I try to do repeatedly. I try to do the movement 10 times, 15 times, 20 times, and it should be purposeful. Any movement you do, it should be purposeful. That is one. Second thing, I talk to the patient. Along when I'm doing the movement or the therapy, I talk to the patient to take the limb backward or forward or bend or straight. Kick, 24. And when it is repeatedly said, some amount of noise which is recorded in the brain is reproduced back to the patient body. Then what happens? I ask the patient to talk to themselves, to the brain, that I'm going to be all right. My limbs and hands, limbs, legs, or my everything is there. I want it back. When they talk, the brain start to realize and they try to regenerate the power. The neural stretch improves, and that is called neural plasticity. The only tissue in the body where it can stretch to the maximum is our brain tissue. So we do repeated movements and make the brain to realize the potential and tap the potential to regain the lost activity, or sometimes children who are coming to us are never got their primary movements like crawling, sitting, standing, walking. So we get the new pattern of movement to the person. The outcome of every injured patient is different, and the treatment plan and the therapy also will vary. It can last from minimum of 3 months to 1 year or 1.5 years or 2 years. But mostly our patients all are improved by first 3 months to 6 months. They have seen the real improvement. Out of every year, about 100 adult patients and minimum of 300 children we treat, an average of 90% recovery we have given. And I also say this, I have cured patients and given a wonderful life for the family and the patient or children or adults who have come to us.